Okay, and the last question from Sonali is, how do you think chiropractic medicine could help someone with severe osteoarthritis? Well, people with osteoarthritis absolutely need chiropractic because when you're talking about severe osteoarthritis, you're talking about joints that have gone from this, where the bone is nice and thick and the disc is nice and thick in there, and in the back there's plenty of space here for the nerve root that goes down. It goes to all the different places of the body depending on where it is in the spine. It may go down your leg, down your arm, go to different organs. And so when you have osteoarthritis, you'll see that there are bone spurs. The disc is bulging all the way around, sort of like a flat tire. It's much thinner than it used to be, so that it isn't as stable as it used to be. So there's a lot of potential for irritation. It can also, the ligaments back here can thicken. You can't see the ligaments on this model, but the ligaments can thicken. Bone spurs can go backward and compromise the nerve root, which can cause real chronic problems like sciatica. Very severe osteoarthritis. You don't even see the disc. And sometimes the bones, if they touch, they'll actually fuse. Now, obviously, you can't do much with a joint that's actually not there anymore because the bones have fused. But often the areas above and below will overstretch, and you have to work around this. So, yeah, people with osteoarthritis and just about anybody over the age of 35 has a little bit of it, and then as you get older, you tend to get more of it. But you'll get areas of the spine still in a person who's very osteoarthritic in a lot of places. You'll still find some areas that are like this oftentimes. So depending on the level of arthritis that there is, and often especially with women or anybody who's had any kind of thyroid problem, you have to watch out for osteoporosis that goes along with the osteoarthritis. So on the one hand, the osteoarthritis, if that were the only thing, if nothing else were an issue, you could really do a very firm kind of adjustment on an osteoarthritic spine. But if there's osteoporosis, you have to be careful. So you have to walk a balance with older people in particular, who are the people who most likely have osteoarthritis. So you want to get those joints moving and getting that pressure off. I said earlier that if you get maybe sometimes 10% of the motion back, get some of that pressure off, you can get a great deal of relief for a patient. So osteoarthritis, yes, definitely. If you have osteoarthritis, you need to see a chiropractor.